Following is a paid commercial program. Views expressed belong to its participants and are not necessarily those of the management and staff of WRAL or Capital Broadcasting Company.
It's time for answers to your medical questions. And get an inside look at the latest in healthcare, medical technology, and treatments. This is Rex on Call.
We have 2 dressing rooms that are completely private.
We're going to learn all about Rex mobile mammography and how it's taken great things to great places. Welcome to Rex on Call live on WRAL. I'm Kim Dean Holderness for Rex Healthcare. Today we're focusing on women's cancers. These are breast and gynecologic cancers. If you're watching us live now and you have questions concerning these types of cancers affecting women, call us now. Your questions may be answered here live on our program by our experts. The experts answering your questions here today are Dr. Linda Van Lee with UNC Gynecologic Oncology at Rex and Lola Alajade with Rex Hematology Oncology Associates. To call us here at Rex on Call, just dial that number on your screen. In Wake County, call 919-744-3876. Outside of Wake County, call us toll free 877-277-6252. You can even email us your questions at rexoncall@rexhealth.com. Tweet us a question at Rex Healthcare, hashtag RexOnCall. Now, until recently, when a woman was diagnosed with cervical cancer, she would undergo a radical hysterectomy to remove all reproductive organs and, of course, any hope of having children as a treatment. But now there's a surgical procedure called a trachelectomy that can still treat the cervical cancer and save a woman's choice to have children. Take a look.
Krista Lassonde was newly married and 31 years old when she got her diagnosis of cervical cancer. Traditional treatments would take her reproductive organs.
Well, it's one of those things where at that time kids weren't even on the brain, but then when the idea of them being taken away and not being able to have them, it does put things into perspective. So that's when you're like, yeah, I do want kids. I don't want that taken away from me.
She met with Dr. John Bogus with UNC Gynecologic Oncology at Rex to discuss treatment. He told her of a relatively new way to treat the cancer and preserve the chance to carry children.
When you combine a cancer center like ours with the technology that is available to us at this point in time, with young, courageous women who have a need, you get pretty amazing outcomes.
The procedure is called a trachelectomy. Performed through tiny incisions with robotic technology, the cervix is removed, but the uterus remains. The outcomes so far show similar success rates in beating cervical cancer as traditional methods.
We're now seeing women who preserve that choice, who are able then to go on and grow their family, which is absolutely amazing.
Dr. Bogus has performed about 30 of these surgeries, the most in the Southeast, and so far 5 of the women have had children, including Crystal.
You know, Jacob's a miracle, but so is Crystal.
What are you looking at?
Jacob's so cute. Now, joining us now are Drs. Linda Van Lee with UNC Gynecologic Oncology at Rex and Lola Alajade with Rex Hematology Oncology Associates. Okay, we'll start with you, Dr. Van Lee. Talk just about this trachelectomy and how robotics are helping that procedure.
Well, there are 2 advancements in that area. First of all, trachelectomy spares the woman. She can retain her uterus and have children. In the past, for a patient with early cervical cancer, they were doomed to having a complete hysterectomy. So it's truly remarkable that we've made these advances, and patients have good survival stats. I think you have to be a very special patient and have certain criteria to be able to have the trachelectomy. On top of that, being able to do robotic surgery is truly amazing as well. Again, in the old days, we'd make an incision, the recovery would be 6 weeks. You'd have to be staying at home, you didn't know what would happen with your incision. Now with robotic surgery, which is really possible because of advancements in technology, it's little incisions similar to laparoscopy, which we all pretty much know about, but because of the technology, the better visualization, it's easier surgery, it's day surgery. Patients can go home the next day and have this remarkable outcome.
That's amazing. Okay, let's talk about genetic testing. I feel like that's a pretty big buzzword. How is that affecting what's happening with breast cancer?
Well, there are certain genetic tests that can be done to determine if a woman has a higher risk of breast cancer than the average population, but you still need to know that the number of women that develop breast cancers due to a genetic mutation is very low. So if there's a very strong family history of cancer or women that develop certain types of cancers like a triple negative breast cancer, then we typically will run a genetic test for the BRCA mutations mainly, but there are other family histories that include multiple cancers that require additional gene testing as well.
Okay, and talk to us about how that genetic testing is playing into gynecologic cancers.
Well, similarly, we are very cognizant of the role of genetic testing, and it's probably a similar percentage, about 10%. However, I would make this point. We can't prevent ovarian cancer. We don't have good screening, but if you could look back in your history and say, oh, I have a couple family members with ovarian cancer, or pay attention to that and bring that to the attention of your physician, you can have an impact. And those patients, we really have some things to do for them.
But when they're filling out that medical history form in their office, they ask about, a parent or grandparent. Does it matter if it's, an aunt or how far away, or like what's included what do you call a family history?
We typically want you to put in any family history that you're aware of, but most relevant is a first-degree relative, at least for the breast cancer risk. So if you have a mother or a sister who's had breast cancer, that's really important. But it's also important to know what age at diagnosis the person had breast cancer. So if you had, a grandmother with breast cancer in her 40s, an aunt in the same side of the family with breast cancer in her 40s, or who was premenopausal, then that does play a relevant role as well.
We actually get an interesting question already. What are the risks for men of breast cancer if there's a family history of breast cancer? So in this guy's family, there's, the women have it. So what's his risk?
His risk may be higher than the average population for a man because he could be in a family that has or carries a BRCA mutation. Now, most men that develop breast cancer do develop it because they carry an abnormal gene, but there are some men who do not have any detectable genes that do develop breast cancer as well. So it's important for men to be aware of the fact that, they can get breast cancer. If there's any change to the breast tissue or chest wall area, it should be brought to the attention of your doctor so they can have that screened.
And when do you recommend for your patients to get this genetic testing? Who gets it?
Well, from the standpoint of our breast cancer patients, usually they come in with a diagnosis, and so going back and looking at their age at diagnosis, their family history determines who gets tested. Also, what type of breast cancer they've had determines whether they get tested or not. But again, if there's a strong family history of, multiple polyps in the family in the colon, multiple colon cancers, pancreatic cancers, unusual tumors, or tumors that seem to fit the criteria for a syndrome, a genetic syndrome, then those individuals get tested as well.
Okay.
Similarly, for ovarian cancer, if you have any family history of ovarian cancer, you should bring it up with your physician, first, second generation. And it's also really important that we are now testing all ovarian cancer patients for BRCA. And we're finding a very high percentage, up to 20%. So for that particular patient, they already have cancer. We're thinking about other things, but for their daughters and their family, huge, because it's autosomal dominant. They could pass it off 50% of the time.
And you're testing the actual tumors and the cancers when you find them. That determines treatments.
What you're doing is actually testing that individual patient's blood or sometimes saliva.
So beyond though, there is you test the cancer itself to determine treatments?
You can do that.
Okay.
You can determine for a breast cancer what type of breast cancer that individual has. And we do have certain gene tests that will tell you whether or not that individual's tumor will respond better to chemotherapy or just anti-estrogen therapy alone. So there are certain gene tests that can be done to specifically choose a therapy or whether or not a patient needs to be aggressive with the type of therapy they use.
And that's happening in gynecologic cancers?
It is. It's very exciting that we can actually determine the genetic mutation in the cancer and then target or choose the custom treatment for that. It's something that's coming up in the years and a very exciting road.
Yeah, 10 years from now, this personalized medicine, what's it going to look like for cancer treatments?
Well, hopefully it'll be what we call targeted therapy. And so a patient will come in with a diagnosis of cancer. We'll be able to run that tumor and determine what drugs that cancer is sensitive to. There will be probably an era where we won't have to use chemotherapy. We'll be using what we call biologic therapy or immunologic therapy to basically help block receptors or stimulate the person's immune system to fight the cancer. So that will come one day, hopefully, but not here yet.
Welcome back. This is Rex on Call live on WRAL. Today we are answering your questions on women's cancers. If you have questions for our experts, call in now in Wake County. Call 919-744-3876. Outside of Wake County, toll free 877-277-6252. You can also email us your questions, rexoncall@rexhealth.com. Let's take these questions. Diagnosed with HPV at age 20, now she's 35. How long would it take for this cancer to appear?
Well, hopefully she's not going to get cancer. And we don't know which HPV. If it's the benign type, then we're not going to get cancer. If it's the high-risk type, then we should be having surveillance so that we can intercept and interrupt this. So I would suppose if you didn't get any care, then you would get cancer, but we're hoping that's not going to happen. We need to have some surveillance.
Is there a way to tell in testing which kind of HPV we're dealing with?
Yes, you could do a test today or in your doctor's office to tell if it's a high-risk type or not. It's
Okay.
very straightforward. It's available anywhere.
Okay, good to know. Okay, Karen from Henderson, 60 years old. She had hysterectomy in 1975, has not had a PAP in 10 years. Her regular OBGYN says it's not needed, but now her regular physician says it is. Does she need a regular PAP smear?
So the guidelines are if you did not have a precancer as a history, nor did you have a precancer in the hysterectomy specimen, one does not need annual PAP smears.
Okay.
Pretty
Okay.
straightforward.
Does aluminum and deodorant cause breast cancer?
That's a categorical no. So there are a lot of myths about breast cancer out there, that deodorant causes breast cancer, wearing bras cause breast cancer, and none of these have been proven in what we call randomized trials, so women can safely use deodorant. There are a lot of other risk factors for breast cancer to include early onset of of menstruation, late onset of menopause, certain lengths of time with use of hormone therapy, obviously the family history that we talked about, but things like deodorant would not be on that list.
Okay. Mary wants to know, is it true that after you're 80, you no longer have to have a mammogram?
Generally, after the age of 80, if you don't have a prior history of breast cancer, then that is correct. We don't need to have people getting routine mammograms anymore at that age.
Okay. Are there any treatments for, any new treatments for stage 4 cervical cancer? Are there any treatments for stage 4 cervical cancer?
Well, the standard treatment for stage 4 cervical cancer is probably a combination of some radiation with chemotherapy. There is something new that just came out from the FDA that shows if you have recurrent disease, we can add new drugs, and they showed a survival benefit. So we are making some headway for people who have recurrent disease. You know, if you have stage 4, we wish people luck that that will resolve, but oftentimes there is recurrence, so there is new treatment for that area.
Okay, that's exciting. This is from May. If you have fibroids in your breast and it stays without surgery, could that, so if you have fibroids in your breast, it stays without surgery, so they've not been removed, could it lead to cancer?
Generally, no. So fibroadenomas are benign tumors of the breast, which are basically just increased growth of the breast tissue. And these are not cancerous or precancerous lesions, so they don't turn into cancer. But obviously, if you have a lesion in your breast that is not biopsied, you may be missing a cancer or a precancerous lesion. So if it's something that she's had a biopsy done from and it's shown to be a fibroadenoma, that will not become a cancer.
Okay. One more way Rex continues to serve the community is through the use of mobile mammography. Here's more on how this mobile unit is bringing care to those who need it.
This Rex mobile mammography unit travels to 17 surrounding counties to bring the advantages of early detection to every woman in our community.
We are going into our mobile mammography exam room. We have digital mammography equipment, all Hologic.
For working women who often don't take time off for themselves, the unit can come to them.
We have 2 dressing rooms that are completely private.
And there are options for the uninsured too.
For uninsured women, we provide funding. We also partner with other clinics that may have funding, so we can provide mammograms for them at reduced rates.
Last year, this unit, funded by support from the K-Yao Foundation and Revlon, performed 5,300 mammograms. 8 were positive for breast cancer. Dr. Rachel Goebel says early detection saves lives.
We do recommend that women have mammograms starting at age 40, unless there's a malignancy in the family, and then they should start earlier.
In addition to mammograms, Goebel reminds all women about the importance of those monthly self-exams.
What exactly are you looking for? What are you feeling for?
You just kind of get used to your own tissue. So you need to do the same way every time and only do it once a month and no more often than once a month. And you'll get used to your own lumpy, bumpy tissue. A lot of women say, I've held lots of lumps, I'm not sure what I'm feeling, but if you do it every month, you'll get used to your normal lumpy, bumpy tissue, and then you'll know if something's different or new.
Welcome back to Rex on Call here live on WRAL. Today we are answering your questions regarding women's cancers, and let's get right to it. Okay, Lynn wants to know, at age 53, she was diagnosed with colon cancer. She's been treated. Her daughter's 32. When should her daughter be tested?
So generally, we say that when people are diagnosed with something like colon cancer, the family or offspring should get tested 10 years prior to diagnosis. So if she was diagnosed at 52, her daughter should start getting tested in her early 40s. And that would be the age that I would recommend for her children.
Okay, this question from Smithfield was emailed into us. I'm 37 with a family history of breast cancer. When should I start having a mammogram?
Again, depends on when her mother or whoever it was, aunt had the breast cancer. So at 37, she probably should get a baseline mammogram now. And if that's negative, she can wait till she's 40. But it really doesn't depend on how old her family member was when they were diagnosed.
Okay, this is from Joanne. I have 3 daughters. What is the age for them to start getting tested for ovarian cancer since I've been diagnosed with ovarian cancer?
Ovarian cancer screening is still being developed, so it's difficult to say definitively that they need to be tested. Also, one person, I would advise that she have some genetic counseling, especially since she had it when she was young, and and really document what her risks are. And then we'd be better able to tell her what kind of screening there is. And I think we need to be really respectful for screening in 2014 because it's not quite perfect, has a lot of flaws.
So how do the symptoms? There are none, right?
There are none.
So how is that? How do we catch it?
A great question. We don't have a great idea. I think in the next couple of years we'll have really, really good screening, but as of today, our screening is a little primitive. It has false positives, might detect something that is not ovarian cancer and scare you to death.
Yeah.
So for her, I would go to her gynecologist, have some genetic testing, really document what the risks are, especially before putting your daughters through screening. It's not easy.
Okay. Gail wants to know, what is the general treatment for vaginal cancer?
Well, vaginal cancer, thank goodness, is quite rare.
Mm-hmm.
So generally, we catch it early, hopefully, and we can treat it with radiation, with a little chemotherapy.
Okay. 3D mammography is very exciting, but this is something you have to ask for at this point, right? Tell us about it.
Well, not every mammography station or unit has that machine, but the CT tomogram or 3D mammogram is a really unique technique. What it does is give you a 3D image of the breast, so it basically goes around and takes pictures of the breast, and it can get through a lot of the density that conventional mammography was not able to detect. So if you have very dense breast tissue, for instance, the CT tomogram or 3D mammogram may be a more appropriate option for you.
And you were saying now they have to tell you if you have dense breast tissue?
Now it has to be reported on the mammogram, so a lot of women are getting mammogram reports that say that they have dense breast tissue, and it doesn't necessarily mean it's a new finding. It just happens to be something that's now being reported.
Because that was a question. It's like, how do I know if I have? Yeah.
And dense breast tissue just means that you have a little bit more breast tissue in relation to fat, but it does increase the risk of breast cancer, or it's been associated with an increased risk of breast cancer.
Simply because it's harder to find?
For several reasons. It is harder to find on a conventional mammogram, but there have been some correlations that have not really been linked to the fact that you can't see small tumors on a mammogram. It may just be that there's something about the increased density that confers a risk of cancer.
Okay. Kimberly from Durham, what causes a breast to bleed? Is this a symptom of cancer?
Typically not. Most of the time, nipple bleeding can be from what we call ductal papillomas or just benign cysts within the breast. But for any nipple bleeding, you really should have a doctor take a look at that to make sure that you don't have an underlying cancer.
Come back to the show. This is Rex on Call, and we're taking a final round of your questions right now. Let's get to it. Okay, Debbie wants to know from Goldberg, after what age do you not need a mammogram?
Well, it really depends on your prior history. So in general, if you are postmenopausal in your late 70s to 80s, you probably don't need one if you've been healthy all your life. But women need to realize that breast cancer actually occurs more commonly in older women. So you need to always be aware of what's going on in your breasts. However, beyond the age of 80, if you've been healthy, there's probably not a need for it.
Okay, explain this. So women still need to have an annual exam, just not necessarily pap smears if they've had hysterectomies, correct?
That's correct.
Correct.
Okay, because we're getting some confusion. Can you clear that up for us?
Sure. So actually the current guidelines are no pap smear after age 65 if you've been clear your entire life, but the exam is valuable for talking about other issues, maybe evaluation of bleeding, the breast exam, the pelvic exam. So there are other reasons to have an annual exam besides just a pap smear.
And for the rest of us, now the paps are every 2 years.
And they can actually be extended every 5 with the HPV testing. So it's remarkable. I think technology just advances and advances. So the HPV testing is really being shown to be quite prognostic and accurate.
Okay, but I was freaking out because they were reducing screening. Yeah, and I think there was a lot of us freaking out because they were reducing screening, but you're not finding it to be.
No,
it's just it's fine.
There's a movement to moving to just HPV testing, so we may see that next year.
Oh, yeah. Well, we'll have lots to talk about in the show next year. Okay, Margaret, what is the treatment for stage 4 metastatic breast cancer?
It depends on the type of stage 4 metastatic breast cancer. If it's hormone sensitive, then typically we will use hormone blocking drugs. If it happens to be what we call triple negative, then the only option is chemotherapy to slow the rate of cancer growth. And there are some women that have what's called a HER2 overexpressed breast cancer, and there are various options to treat that as well.
Okay, we have a question, and I'm surprised it's our first one, about estrogen and hormone replacements after a hysterectomy, because what are the considerations for its impact on breast cancer?
Well, it's, again, another tricky subject, because after a woman has had a hysterectomy, depending on how old you are, that can obviously impact your quality of life greatly by depleting your hormones. Now, that's if you had a total hysterectomy that removed your ovaries as well. What we have found is that women that use a combination of estrogen and progesterone supplements for more than 5 years do have a higher risk of breast cancer. It seems that using just estrogen supplements alone does not confer the same risk. So it depends on the individual, how long they've been on the hormone supplements, and whether or not it's something they really need to be on.
Yeah, I mean, but even with increased risk, there's a lot of women out there who say, I don't care, it's not a good life to not have them.
Right.
So just more screening, or just more frequent, or?
Well, screening will still be, again, the
A
standard
year.
for the age, depending on what their history is. But obviously, if they need to be on hormone replacement therapy for debilitating symptoms, then that may be something that they have to discuss with their doctor.
Okay, in 2008, Janie here had a triple bypass in 2008. She's currently has breast cancer, and she's going through chemotherapy. She's concerned about the radiation because of her heart. How does radiation affect a heart condition?
Depends on what side. So if she had a left-sided breast cancer, obviously the heart is behind the left breast. There are lots of techniques now to gate or determine the depth of radiation treatment, and so a lot of times they will protect the heart or shield the heart. So she may not necessarily be at significant risk. Depending on which of the arteries was used in the bypass, if it's in the way of radiation, they may have to block the field of radiation so it doesn't hit that artery, but there are ways that she can get around it.
Okay, that's great. Okay, as always, please consult with your physician about any health concerns. And before we go, we have some cancer-related community events to tell you about. This weekend, Rex and the North Carolina Minority Prostate Cancer Awareness Action Team will host a free prostate education seminar. It's free. Living with and Beyond Prostate Cancer will be held on Saturday, September 20th at Martin Street Baptist Church in Raleigh. Also, Rex will be turning October pink with several breast cancer awareness activities, including participating in Johnson Health's Ladies Night Out event on October 28th. It's free as well and will include health information, tours, food, and prizes. Visit rexhealth.com for more information about these events and lots more. And finally, if you're looking for a doctor beyond today's show, you can call Rex's free health information hotline. That's at 919-784-4490. Our Rex Health Net experts will link you up with a doctor and help find you that perfect referral. Again, that number is 919-784-4490. Thank you very much, ladies, for being here and answering our calls, and to our phone bank for taking those calls. Join us next month. Our topic, better health after the age of 65. That's on Monday, October 20th at 1 p.m. here on WRAL. Send us your questions ahead of time to rexoncall@rexhealth.com. We will see you next time. Thanks for joining us.
This has been a paid commercial program. Views expressed belong to its participants and are not necessarily those of the management and staff of WRAL or Capital Broadcasting Company.